Hello, my name is Scott Smith, and I'm a technical consultant with the Centers for Behavioral Health and Justice. And today we're going to talk about the terminology common to the use of assisted outpatient treatment. These are terms that frequently are brought up or used and might not be familiar to everyone. So we wanted to make sure that you had a resource to better understand what is meant with some of the terms, some of the diagnoses, vernacular that comes up. Treatment terminology. We're going to start our discussion of treatment terminology with the DSM, or Diagnostic and Statistical Manual of Mental Disorders. This is the diagnostic guide used to make a diagnosis of a mental illness and/or a substance use disorder. And it contains objective criteria for making such a diagnosis. When a mental health professional makes a diagnosis, they have to look at some very clear, objective criteria, often featuring timeframes, in order to make a diagnosis. And this is so important because we're not yet at a point where we can use laboratory results or medical imaging technology in order to make a diagnosis. So it requires a certain amount of subjective interpretation of what an individual is going through in order to determine whether they're meeting these objective criteria. Treatment. When we talk about treatment broadly, we're referring to any effort to prevent, cure, and/or lessen the severity of a condition. Sometimes we'll break this down and talk about prevention, which is a form of intervention to try to prevent something, right? Sometimes our treatments will be of someone that has a chronic condition like schizophrenia, and our efforts are no longer to prevent it or cure it, but rather to help the person lessen the severity of that condition or manage the associated challenges that come along with that illness. And the best forms of treatment are the ones that you'll hear referred to as evidence-based treatment. And these are treatments that have been studied and have multiple scientific studies, in fact, that help demonstrate their effectiveness. Now, there are a lot of new and emerging treatments that are worthy of consideration if evidence-based treatments are not being successful. But the reason that we emphasize and rely on evidence-based treatment is because they have been proven to have the potential to help individuals. And we want to always start with what we have the best sense will work. Now, we can administer treatment in a variety of settings. Outpatient treatment is when we administer treatment outside of the need for an overnight stay. So you're not staying in the hospital or some other facility overnight, what we're going to refer to as an inpatient type setting. But this is more what most of us do to maintain our health in any way. We go to doctor's appointments, and we try to go to doctor's appointments so that we can avoid a health condition getting worse and having to be admitted to the hospital. So outpatient treatment, when you see that referred to, is typically going to refer to community-based services, such as a psychiatrist office visit or therapy appointment. Earlier intervention. This is a term that we've been using in recent years to refer broadly to the efforts we're trying to make to engage people in services designed to manage their serious mental illness, such as medication-based treatments, vocational support, doing this as close as possible to the actual onset of their illness. And that's because researchers have found a strong correlation between earlier intervention and a person's prognosis. The earlier the intervention, the better their prognosis is, the more likely they are to be able to live a life where their symptoms are managed and they're free to pursue the goals that we all have for our lives: being happy, finding meaningful work, having ongoing relationships. Although those can be possible. Higher level of care. Now, this is terminology that you might hear when there's a discussion about the need to do something other than outpatient treatment. because a higher level of care refers to a person's need for psychiatric services that simply can't be performed outside of, a specialized facility or hospital. So this is when a person's need for psychiatric services exceed what can be provided in traditional outpatient treatment. And one of the most common forms of higher levels of care is inpatient treatment, or often referred to as inpatient psychiatric hospitalization. And this is, as the name implies, treatment that occurs in the hospital that requires an overnight stay. Now, that hospital might be a freestanding psychiatric facility that only treats psychiatric disorders, or it might be a unit within a traditional medical hospital. But when the person is staying there overnight for treatment, that's what's going to define it as inpatient treatment. This should be distinguished from somebody who's in the emergency department overnight or for multiple days waiting for subsequent treatment. That's not classified as inpatient treatment. And to be quite candid, is not even classified as ongoing treatment. It's more of a safe holding environment. And that's because emergency departments don't often have the ability to provide much in the way of treatment. Now, the services that are available in inpatient settings include medication evaluation and management. This includes trying new medications if old ones weren't working, increasing or decreasing dosage if that may have been contributing to a problem. Group therapies are also a typical service included, and these cover a wide range of issues. And importantly, what we broadly would refer to as behavioral monitoring. When we're looking at inpatient treatment, it's usually because we are concerned that the person may intentionally or unintentionally hurt themselves or others, and they need closer supervision that realistically can't happen outside of a controlled environment. Crisis residential unit is an alternative to inpatient treatment that typically occurs in a facility other than a hospital while providing many of the same services. Now, crisis residential units very often are actual homes where an individual is going to receive the same type of medication assistance, interventions such as group therapy, but less of the behavioral monitoring than they would receive in an inpatient setting. And often that becomes the biggest determination of which is more appropriate. Somebody who can't realistically be counted on to not just wander off from the crisis residential unit is probably better served in an inpatient treatment. Partial Psychiatric Hospitalization Program, PPHP. This is a full-day form of outpatient treatment where an individual receives many of the same services offered in an inpatient hospitalization without the need to stay overnight. This is also known as Partial Hospitalization Program, PHP, and is a great way to either avoid an inpatient hospitalization or to help somebody transition out of an inpatient hospitalization. Sometimes we can discharge people from an inpatient setting earlier by discharging them into a partial hospitalization program as a step down as they get ready to re-enter their normal life. Psychiatric urgent care. You'll sometimes hear people refer to these as PUCs. And this is a walk-in facility for mental health and/or substance-related treatment. No appointment necessary. These can be offered in conjunction with a variety of institutions such as hospitals, community mental health organizations, community mental health contract organizations, but they're an attempt to make more immediate services available to individuals in the community. Voluntary treatment. Voluntary treatment is quite simply treatment that a person willingly consents to receive. This can be either outpatient or inpatient. Conversely, involuntary treatment is treatment that a person does not consent to receive, whether it's inpatient or outpatient. There are legal guidelines around the use of involuntary treatment, such as those required for involuntary outpatient treatment, essentially what assisted outpatient treatment is. and the probate court has the jurisdiction over such cases. Non-adherent with treatment. Sometimes people will use the terminology non-compliant with treatment, which is how Michigan's mental health code currently reads. But this simply refers to somebody who was in treatment, a course of treatment was recommended, and they have now stopped participating in that treatment, either fully or partially. Maybe they stopped taking one of their medications. Maybe they're taking their medications, but not going to their vocational services or meeting with the housing coordinator. Whatever the break from the recommended treatment is, it's broadly categorized as non-adherence. Thank you for taking time to view this training. This training is presented as part of the Michigan Assisted Outpatient Treatment Toolkit. And to learn more, visit behaviorhealthjustice.wayne.edu/AOT.